If I could sum up my experience as a patient advisor in one word, that word would be fulfillment.
I serve on one of the many patient and family advisory councils, or PFACs. One of my favorites is the committee which helps look at different patient brochures and information out of hospital, in hospital, for pre-surgery information. We critique them.
During our conversation with the head of the Department of ED, we talked about implementing more space in the new Destination Grand building. There will be private rooms there, they will have more security. Individuals will see the difference in space.
The great part of our patient advisor program is our unique flexible engagement model. This model allows patient advisors to choose how much they would like to participate in the following 4 categories. Health system advisors are an important aspect to improving healthcare quality processes and delivery of care. They serve on ongoing councils and committees throughout Henry Ford Health. E-advisors is for those who may not be able to dedicate as much time but would still like to make a positive impact. Usually this involves filling out process improvement and research study surveys that advisors are emailed. Focus group advisors. PERC collaborates with teams throughout the health system and beyond to conduct focus groups and interviews that will collect feedback on a certain topic or research area. Research project advisors. Research is a big part of what we do at PERC. Patient advisors often serve as study team members on research projects. Patient advisors can participate in as many of these categories as they would like. They can even choose to flex between the categories.
As healthcare workers, we work day in and day out with other healthcare workers, and sometimes it takes a patient to really open our eyes to get to the point of, or the actual problem we're trying to solve. And so working with patients can really be transformative in the direction of an initiative. One of the system-level initiatives that I'm most proud of is our inpatient guidebook. This was an initiative brought on by leadership to standardize the books we hand out to our patients in the hospital. When we brought the book to our PFAC, we really thought we had a polished book. We had gone to all of our experts in the hospitals, we worked with marketing, we worked with quality, and we thought we were ready to print. Maybe the advisors would pick up on some typos or just a couple mistakes. And when we left the meeting, we had so many opportunities to make the book better.
Physicians who treated cancer thought, well, once radiation and chemo and follow-up visits were done, that was it. But one of the main subjects that we talked about was survivorship and how cancer becomes part of that patient's life and being.
I become friends, with a lot of these people and the leaders, the team leaders and researchers, and people like that, that allow, me also being a retiree, it's kind of a nice social engagement, to be able to meet new people, that share common interests.
The PFACs are ran very structured. The leaders may come in from the departments, they go over their presentation. As they're going over their presentation, we're allowed to stop them, ask questions, find out when they're going to report back to us. And I think that they value that. I know that they value that.
If you are a patient or caregiver interested in becoming more involved, sharing your perspective in healthcare, and contributing to the behind-the-scenes initiatives, becoming a patient advisor could be the right opportunity for you. You can apply through our website, and a team member will contact you to discuss the next steps.